Hi, I'm Dr. Mary Medeiros, and welcome to Thrive Adult Primary Care. This is my brand new direct primary care practice in Franklin, Massachusetts, and I can't tell you how excited I am to be able to practice medicine unshackled from a system that is known to be broken, providing patients with care that is simple, efficient, and personal, the way it was meant to be. I'm looking forward to talking more about it, but I'd like to kick things off today discussing an issue that is on the forefront of many of our minds with open enrollment around the corner and skyrocketing health insurance premiums along with it. So there is a fear out there that I and my family are not going to be able to access the healthcare we need when we need it. And there's also a perception that the only way to access healthcare is through health insurance. We use these terms interchangeably, and the question I would like to pose is, should we be doing that? Are health insurance and healthcare the same thing? And if not, then what is it that we really need? Is it health insurance or is it something else? So I'm going to use an analogy to illustrate this point. It departs a bit from the topic of health, but hopefully is relatable enough and applicable enough to help make things more clear. Let's say you're an average everyday person and you're trying to get from point A to point B. Let's say point A is your home. Let's say point B is the grocery store. It's far enough away that you probably don't want to walk. So how many of us say, I'm going to solve this problem by going shopping for a fancy, beautiful, brand new car insurance policy? Is that what you do? Is that your first step to get from point A to point B? I don't want to walk anymore. I'm going to call up Progressive or Amica or Geico and ask them to solve this problem for me. No, that's not what we do. We shop for a car. There are certain features that you want in that vehicle, and you're going to invest your time and energy and money into choosing the vehicle that you really want. And when you find it, it's going to hold value for you. Because of that, you actually are going to purchase insurance. Number one, it's the law. Number two, it's important to have if bad events occur. God forbid you drive off the sales lot with your brand new, shiny, beautiful vehicle, and there's a stiff wind and it blows a dead tree onto your car. Insurance is there for you to get you through those unexpected, rare events. Now, if you're like most people, you're probably shopping for a fairly small insurance policy, something that won't cost you an arm and a leg on a quarterly or monthly basis. And the goal is to avoid using it. If you file a claim, it may have a high deductible, but at least you're saving money on a regular basis. And you try to keep that money by taking good care of the car. And you're gonna get the oil changes to avoid breakdowns. You're going to get the tires rotated and changed when appropriate to avoid flats. And you may have a relationship with a good mechanic that you know you can trust, who will get your work done at a cost you can afford. Now, you pay out of pocket to the mechanic for that preventive maintenance. Insurance doesn't take care of it for you. Imagine if it did. If we had to go through insurance every single time we needed an oil change. That would be filing a claim. And every time you file a claim, insurance views you as a liability, because what would have been as simple as handing money over to the mechanic now has to go through several sets of hands, and that's work they're doing on your behalf. So that would motivate them to increase the premiums. And who wants that? The bottom line is that insurance does play an important role. However, it should be limited, especially when it comes to routine prevention and maintenance. So let me break it on down. What we ultimately need and want is a vehicle that is in tip-top shape. And a key to maintaining that is having a relationship with a service provider who will maintain it with routine preventive maintenance and also addressing the little things as they come up with a predictable, affordable cost, without having to go through insurance for that routine maintenance, lest the insurance premiums grow. So drawing back to the original question, what do we really need? Is it health insurance? Plays a role, but I'm not sure that's the ultimate bedrock, because you only need to have it there when something goes wrong, and who wants everything always going wrong? Is it health care? well. It's great to have access to go back and forth to the doctor, but that would mean that you're sick. So that's not really what we ultimately want either. I submit to you that what we have is not a crisis of health insurance, not a crisis of health care, but it is a crisis of health. And what we really deserve is to learn how to maintain and seek that health ourselves. I am really excited to talk to you about this in upcoming videos. In the meantime, if you liked this one, please like it, share it, add a comment. I'm also in a future video going to break down how the cost savings manifests for the typical American family using lower premium, high deductible insurance plan paired together with a direct primary care physician who is invested and has a relationship with you and your family. So I look forward to seeing you next time, and in the meantime, stay well.